Hi, I'm John Clark. I'm a postural alignment specialist certified by the Ecise Institute to teach postural therapy. Today, we're going to be talking about an Ecise called sitting knee pillow squeezes. Before I get into the instruction of sitting knee pillow squeezes, let's talk a little bit about the equipment you need. There are lots of ways you can do this. You can use just a couch cushion, or depending on the width of your hips, you can use a thinner yoga block or a thicker yoga block. I'm a big guy. I prefer this kind of thicker yoga block. You can see the difference in thickness there. You can use a ball, and I wouldn't necessarily recommend this, but if you have a thigh master or something like that, you can experiment with things like that. Again, none of this is advice specifically for you. These are things I've done in the past with my body. But the last thing you're going to need, you are going to make sure that you have a proper height bench. I do not want to see your knees above or below your hips. Your knees should be in line with your hips. To within at least about a centimeter difference either way might be okay, but really nothing more than that. It should be very horizontally aligned. Ankles are directly underneath the knees. They're not in front of the knees, they're not behind the knees. Ankles are below the knees. When we look at our feet, we want to make sure that our feet are, the middle two toes of our feet are pointing ahead. If your big toes are pointing straight ahead, like you'll see in this picture on the screen, then your feet are out of position. We want those feet so that the middle toes are pointing straight ahead, or really that line between the middle toes is pointing straight ahead. Then we want to make sure that we have a curve in our lumbar spine here. We want to maintain this arch in the lower back throughout the entire exercise. If you feel yourself slouching like this, flattening that lower back, you may need to contact your therapist if you're seeing one, or you're not ready for this exercise and don't have the strength in that spine to bring it into extension, and this exercise might not be the one for you. Also, once we start talking about the upper body, we want to make sure that the shoulders are directly above the hips. You may be able to maintain that curve in your lower back, but if you have to lean forward to do it, that's not right. If you have to lean back to maintain that curve, again, not what we're looking for. We want a curve in the lower back, shoulders directly above hips, ears directly above shoulders, if possible. If your head is going a little forward or something, that's okay to start with. This exercise might even help bring it back, but we don't want you leaning forward, the head taking you forward, even if you can maintain that arch in the lower back. This arch in the lower back is just so critical. Now, if you use a block, you have really two options. You can use it sideways, the narrow way, or this way. I do not want to see the block like this between your knees. If it's like this, our knees are too far apart. I want the knees about hip width apart, or maybe just a little bit in from hip width apart. So using the block this way, the narrow portion will probably bring your knees a little bit more than hip, or a little less than hip width apart. But that might be too difficult or too painful for people just starting out. I really recommend trying this position first. It's the middle dimension of the block. Now finally, when we get to doing the exercise, we are just going to squeeze slowly, release slowly. We're not trying to murder the block. This is 25 to 50% of your strength. We are maintaining the curve in the lower back, and 25 to 50% squeeze, slowly release. Now, why is the speed so key here? Look what happens if I start doing it quickly. You see how my upper body wants to respond? Because I'm placing a demand on there really quickly, we don't have time to consciously control all the rest of those muscles. So it happens with a quick release too. See how my legs kind of should get wobbly down here if I do a little release too quick, because I'm trying to make sure I don't drop the block at that point. So we have to make sure we keep a slow, even speed with both contraction and the release. Each part should take about a second for 2 seconds per repetition. Now you notice that I've got my hands resting on my thighs here. This is to keep a load in front of the shoulders, a load off the shoulders. This will also be helpful with maintaining that position of the shoulders over the hips. Typically, you'll have 3 sets of 20 repetitions of this Ecise. So, if you do that fully, at 2 seconds per repetition, you're talking about 40 seconds per set. So, a little under, about 2 minutes for doing this whole set of exercises, or whole set of reps here. And that's all there is to it for knee pillow squeezes. This is a great exercise for, let's talk about the postural changes you're going to see in this Ecise. Well, if I'm strengthening the adductors, that makes it so that the hip flexors aren't having to do as much work because the adductors are doing their jobs. And posturally, that means that if I have 2 femurs out of position, maybe they're both external, but one's more external than the other, so we got this rotation going on, an uneven rotation. This exercise is going to help bring both of them to the same rotation. And it's also going to help reduce rotation in the hips and pelvis as a result. And it can even help with pelvic tilt, and it can really help release those lower back muscles. Once the hip flexors aren't trying to do so much work for so many other muscles, it lets those other muscles do the job they're supposed to do, and it can really feel great in the low back, it can feel great in the hips, it can feel great in the groin,